Psychological manipulation. Psychological manipulation is a type of social influence that aims to change the perception of behavior of others through underhanded, deceptive, or even abusive tactics. By advancing the interests of the manipulator, often at another's expense, such methods could be considered exploitative, abusive, devious, and deceptive. Social influence is not necessarily negative. For example, the doctors can try to persuade patients to change unhealthy habits. Social influence is generally perceived to be harmless when it respects the right of the influenced to accept or reject and is not unduly coercive. Depending on the context and motivation, social influence may constitute underhanded manipulation. So read about the requirements for successful manipulation. Manipulators control their victims. Vulnerabilities exploited by manipulators. Motivations of manipulators. Psychopathy. Antisocial borderline and narcissistic personality disorders. Machiavellianism. Histrionic personality disorder. Requirements for successful manipulation. Concealing aggressive intentions and behaviors. Knowing the psychological vulnerabilities of the victim to determine what tactics are likely to be most effective. Have a sufficient level of ruthlessness to have no qualms about causing harm to the victim if necessary. How manipulators control their victims. Positive reinforcement, praise, superficial charm, sympathy, excessive apologizing, money, approval gifts, attention, facial expressions, such as a forced laugh or smile, and public recognition. Negative reinforcement involves removing one form from a negative situation as a reward. Intermittent or partial reinforcement. Partial or intermittent negative reinforcement can create an effective climate of fear and doubt. For example, in most forms of gambling, the gambler is likely to win now and again but still lose money overall. Punishment includes nagging, yelling, the silent treatment, intimidation, threats, swearing, emotional blackmail, the guilt trip, sulking, crying, and playing the victim. Traumatic one-trial learning, using verbal abuse, explosive anger, or other intimidating behavior to establish dominance or superiority. Even one incident of such behavior can condition or train victims to avoid upsetting, confronting, or contradicting the manipulator. According to Simon, identify the following manipulative techniques. Lying. One way to minimize the chance of being lied to is to understand that some personality types, particularly psychopaths, are experts at the art of lying and cheating. Lying by omission. The technique is also used in propaganda, withholding a significant amount of the truth. Denial. Manipulator refuses to admit that he or she has done something wrong. Rationalization, an excuse made by the manipulator for inappropriate behavior. Rationalization is closely related to spin. Minimization, this is a type of denial coupled with rationalization. The manipulator asserts that his or her behaviors is not as harmful or irresponsible as someone else was suggesting. Selective inattention or selective attention. Manipulator refuses to pay attention to anything that may distract from his or her agenda. Diversion. Manipulator not giving a straight answer to a straight question and instead being diversionary. Evasion. Similar to diversion but giving irrelevant, rambling, vague responses. Covert intimidation. Manipulator throwing the victim onto the defensive by using veiled, subtle, indirect, or implied threats. Guilt trip, a special kind of intimidation tactic. A manipulator suggests to the conscientious victim that he or she does not care enough, is too selfish, or has it easy. Self-doubting, anxious, submissive position. Shaming. Manipulator uses sarcasm and puts down to increase fear and self-doubt in the victim. Manipulators use this tactic to make others feel unworthy and therefore defer to them. Shaming tactics can be very subtle, such as a fierce look or glance, unpleasant tone of voice, rhetorical comments, subtle sarcasm. Manipulators can make one feel ashamed or even daring to challenge them. It is an effective way to foster a sense of inadequacy in the victim. Playing the victim role, a manipulator portrays him or herself as a victim of circumstance or someone else's behavior in order to gain pity, sympathy, or evoke compassion, and thereby get something from another. Caring and conscientious people cannot stand to see anyone suffering, and the manipulator often finds it easy to play on sympathy to get cooperation. Vilifying the victim. More than any other tactic is a powerful means of putting the victim on the defensive while simultaneously masking the aggressive intent of the manipulator. Playing the servant role, cloaking a self-serving agenda in guise of a service to a more notable cause, for example, saying he is acting in a certain way to be obedient to or in service to an authority figure or just doing their job. Seduction. Manipulator uses charm, praise, flattery, or overtly supporting others in order to get them to lower their defenses and give their trust and loyalty to him or her. Projecting the blame, blaming others. Manipulator scapegoats in often subtle, hard to detect ways. Feigning innocence. Manipulator tries to suggest that any harm done was unintentional or that they did not do something that they were accused of. Manipulator may put on a look of surprise, of indignation. The tactic makes the victim question his or her own judgment and possibly his own sanity. Feigning confusion. Manipulator tries to play dumb by pretending he or she does not know what the victim is talking about or is confused about an important issue brought to his or her attention. Brandishing anger. A manipulator uses anger to brandish sufficient emotional intensity and rage to shock the victim into submission. The manipulator is not actually angry, he or she just wants to put on an act. He just wants what he wants and gets angry when denied. Vulnerabilities exploited by manipulators. Disease to please. Addiction to earning the approval and acceptance of others. Emotophobia, lack of assertiveness, blurry sense of identity, low self-reliance, external locus of control. Manipulators exploit the following vulnerabilities that may exist in victims: naivety, over-conscientiousness, low self-confidence, over-intellectualization, emotional dependency. Cantor advises in the books the following: vulnerable to psychopathic manipulators, too dependent, too immature, too naive, too impressionable, too trusting, too lonely, too narcissistic, too impulsive, too altruistic, too frugal, too materialistic, too greedy, too masochistic, the elderly. Motivations of manipulator: the need to advance their own purposes and personal gain at virtually any cost to others. Power and superiority in relationships. Control freak, self-esteem, boredom, psychopathy, antisocial, borderline, and narcissistic personality disorders. Histrionic personality disorder, high functioning both socially and professionally. Machiavellianism, tendency to be unemotional. Read also about advertising, appeal to emotion, blackmail, brainwashing, bullying, culture of fear, coercion, persuasion, common sense, confidence trick, critical thinking, crowd manipulation, dark triad, deception, demagogy, dirty tricks, discrediting tactic, dissimulation, dumbing down, emotional blackmail, enabling, fallacy, fear-mongering, fraud, gaslighting, half-truth, interrogation, list of confidence tricks, list of fallacies, lying, martyrdom video, media manipulation, mind control, mobbing, personal boundaries, persuasion, propaganda, the formation of men's attitudes, psychological abuse, psychopathic thought processes, rhetoric shaming, shills, slut shaming, smear campaign, social engineering, political science and security, social influence, sophistry, spin, subliminal substimuli, victim blaming, victimology, weasel words, whispering campaign, workplace bullying. Read all about psychological manipulation.